Hello, good morning. It's a wonderful Wednesday. My name is Denise Apomaide. Welcome aboard to AM News. In our very first story, government has tasked all ministries to reflect gender mainstreaming in their sectors as part of efforts to promote equal opportunities for all and accelerate national development. At the launch of the National Gender Policy and ahead of International Women's Day, Minister for Gender, Children and Social Protection Agnes Namumulati says the successful implementation and compliance of the policy will require a collective effort from all stakeholders.
The 2025-2034 National Gender Policy. The policy aims to reduce gender-based violence and promote equality across the country. According to the Minister for Gender, Children and Social Protection, Dr. Agnes Namumulati, the policy provides clear guidelines for achieving gender equality while encouraging women to build self-confidence and stand up for their rights.
It is not just about launching the policy, it is about making it known to Ghanaians, because if you are not aware of your rights, it will be difficult for you to assess your rights. And so whatever is contained in the document, we need to come up to let Ghanaians know what they stand to benefit, the things, the plans of the nation or the state for them, especially the commitment of His Excellency John Dramani Mahama towards women's empowerment, economic empowerment, the education of women and girls, and then ensuring that in all spheres we mainstream gender and then ensure that there's gender equality at the end of the day. Most importantly, meeting our targets as stated in the Affirmative Action Act.
Gender policy.
As chairperson of the Parliamentary Select Committee on Gender, Children and Social Welfare, I wish to assure the ministry and the people of Ghana that Parliament stands dedicated to provide legislative support, exercise its effective oversight, advocate for adequate budgetary allocations, and promote cross-sector collaborations.
Implementation of the policy to help accelerate Ghana's growth and development.
Now, let's talk about healthcare. Healthcare delivery at the Cape Coast Teaching Hospital has entered a new phase following the commissioning of a state-of-the-art eye care and surgical training center. The facility, a collaborative initiative between the hospital and the Cure Blindness Project, is first of its kind in the Central region. Speaking at the ceremony, the Deputy Minister of Health, Grace Ayentu Dankwa, said the center aligns with government's flagship health programs, including the Mahama Cares Initiative, and also described it as a renewed source of hope for specialized healthcare delivery in the country.
In his welcome address during the commissioning of the new facility, the Chief Executive Officer of the Cape Coast Teaching Hospital, Dr. Eric Kofi-Njedu, described the center as a major milestone in advancing specialized healthcare services.
It is indeed a game changer. The Cape Coast Teaching Hospital was established in 1998 by His Excellency, and may so rest in perfect peace, Flight Lieutenant Jerry John Rawlings, as a regional hospital, and was elevated to a teaching hospital status in the year 2014. Since then, our mandate has expanded significantly. Today, we stand as the only teaching hospital in the region, serving the central, the western, and parts of western north and neighboring regions. With this mandate comes a responsibility to provide advanced tertiary health care, to train health professionals, and to lead innovation in service delivery.
The Chief Executive Officer of the Cure Blindness Project, Katie Overbay, reaffirmed the organization's commitment to eliminating avoidable blindness.
This eye care center will enable the Cape Coast Teaching Hospital to serve more patients, not just in this immediate area, but in all of Ghana, and provide even greater eye care. At the same time, this will be a center of excellence for teaching and training new eye care personnel, which will lead to the long-term sustainable solutions for eye care in the country.
Present at the commissioning, the Central Regional Minister, Ekol-Payne Ejiamwa-Ochre, lauded the hospital's management and partners for complementing government's efforts to improve healthcare delivery.
The resetting agenda includes providing health infrastructure, of which the eye care health facilities are not escaping attention. First and foremost, let me thank the management of the teaching hospital for this intervention. Indeed, government alone cannot provide the various infrastructures that we need for development of a nation, and that's why we do welcome support from the donors. We thank you so much for your support.
The Deputy Minister of Health, Grace Ayensu-Dankwa, also noted that the new facility aligns with government's flagship health programs.
We realize that 43% of all deaths in our hospitals are from non-communicable diseases and cancers. Non-communicable diseases in Ghana, number 1 is hypertension, high blood pressure. Number 2 is diabetes. Both of these diseases lead to eye problems. So having this center here ties right in line with one of the government's flagship programs, the Ghana Medical Trust Fund, also known as Mahama Cares. It also ties into our other flagship program that would be launched next month. That is the free primary health care, because this facility will provide preventative and promotive eye care services.
The newly commissioned Eye Care and Surgical Training Center is expected to expand cataract services, train future ophthalmologists, and increase access to sight restoring treatment across the central region and beyond. From Cape Coast, Abigail Lissel Nkrumah reports for Joy News.
From healthcare, let's do education. The principal of the Nusrat Jahan Ahmadiyya College of Education, Shani Osman, has expressed concern over inadequate teaching and non-teaching staff, saying the shortage is affecting effective teaching and learning. He revealed that in recent years, 2 staff have retired, 7 resigned, and 2 passed away, leaving the remaining lecturers, particularly in the English department, overburdened. Speaking at the college's 8th matriculation ceremony under its affiliation with Akintin Apiaminka University of Skills Training and Entrepreneurial Development, he appealed to government for clearance to recruit more staff. Joy News' Rafiq Salam reports from Wa.
Principal of the Nusrat Jahan Ahmadiyya College of Education, Sani Osman, noted that the highly competitive nature of this year's admissions were heavily constrained by government quotas, while 1,180 of the 1,631 first-choice applicants were deemed qualified. Only 379, representing 32%, were admitted. Reaffirming the institution's commitment to inclusive education, the college also welcomed 2 visually impaired students into the cohort. Sani Osman outlined several major infrastructure developments aimed at improving the students' experience.
I also wish to express our appreciation to government for the re-award of the 300-bed capacity student hostel project. This project was initially awarded in 2022, but abandoned after the contractor was shown the site. In addition, I'm pleased to report that the government, through GET Fund, has granted financial clearance for 3 stall projects. Already, the contractor for the stall 3-story lecture hall complex with offices has returned to site and work is progressing steadily. We are hopeful that work will soon begin for the auditorium complex with ancillary facilities and the boys' hostel.
The NJA College of Education principal issued a pressing appeal regarding a severe human resource deficit.
14 staff, 7 of them teaching and 7 non-teaching. This is mainly due to retirement. 2 of our teaching staff retired last year. Then we have 10 of our staff, both teaching and non-teaching, resigning to take up opportunities elsewhere. Unfortunately, we also lost 2 of our staff. In this regard, we respectfully appeal for clearance to recruit additional staff to augment the existing faculty. The workload is becoming increasingly burdensome for currently our English language lecturers, because out of the 7 teaching staff that left the college, 4 of them are English language lecturers.
A central theme of the ceremony was the strict moral and professional standards required of the teaching profession. Management reiterated a zero-tolerance policy regarding sexual harassment, the use of illicit drugs and alcohol on campus. He also touched on the issue of students' pregnancy. Guest speaker for the
a careful consideration and in alignment with policies implemented in other similar institutions, the college administration has come up with this policy. Students who become pregnant during their studies will need to arrange off-campus accommodation immediately. The moment we see that you are pregnant, we are not sacking you, but we advise that you look for accommodation outside campus. This policy aims to ensure proper medical care is readily accessible and reduce risks associated with emergency situations in residential facilities. We encourage all students to make informed decisions about their health and academic journey.
Guest speaker for the occasion was Professor Constance Awimpogo-Akurugu, who is an associate professor of sociology and gender studies at UBEX, who challenged female students to reject social stereotypes regarding women's intellect.
Believe in yourselves. If women have made it, their lecturers, their doctors, their professors, their vice chancellors, their vice presidents, and who knows, one day we might even have a female president. There is nothing preventing you just because you are a female from making it beyond.
Reporting for Joy News, Rafik Salam. Wow.
Let's stay a while on education. For nearly a decade, pupils of Jibri DAJHS reported to a school that wasn't really a school. They sat in a makeshift structure, learning under harsh conditions, while their parents watched enrollment numbers drop. But after 8 long years of struggle, the story has taken a dramatic turn. In just 4 months, a campaign promise has become a gleaming reality. And the headmaster says he is so excited he won't be sleeping that night. And Asabit has more.
Imagine going to school but not having a real school to go to. For 8 long years, that was the reality for children in Jibri. Their lessons were held in a cramped makeshift space, and for many families, it was simply not worth the risk. Some parents even pulled their children out. Headmaster of the school, Ponaka Donko Evans, says the situation was very dire. It affected enrollment as some parents withdrew their wards.
We have been sitting under shade or pavilion for about 8 years now. And because of that, due to the infrastructure challenge, sometimes people will even come for admission and their children will look at the infrastructure and then they will go and come no more. Because of the nature of the classroom or where we have been sitting for classes, most of even the children who are in this town prefer to go to outside where there is what? Infrastructure. So it has seriously affected enrollment and also academic performance.
Help came from their Member of Parliament who doubles as the Trade Minister, Elizabeth Ofosu-Ajari. She cut the sort for a new junior high school block with a 6-month completion target. But in a remarkable turn of events, it took just 4 months. Today, the project is not just complete, it's been handed over to the school.
We cut the sword for the construction exactly 4 months ago. And even though we said we're going to do it in 6 months, in 4 months we've delivered. I've also provided chairs and tables for them. I'm bringing them a computer also because this is kind of my own baby. So I want to make sure that they get all the compliments they need for the school. So I'm very excited and I'm so grateful to Excellency John Dramani Mahama, walking the talk, promising that he will give education to everyone, every child in Ghana. and exactly what he's delivering through us. So we thank him very much for this.
For the traditional leaders here, this day erases years of frustration. Efforts to get a block in the past had proven futile. They were thankful to the MP. For the peoples here, it is a dream come true.
Today is a special day for JBD Basic School. We are very, very happy about what we have get today. We thank Honorable Elizabeth Ofosu Ejare.
Headmaster George Evans could not hide his excitement. He says their academics will definitely improve.
I woke up around 3 a.m. because I knew that today was a community day. I couldn't even sleep, and I'm sure it will continue like that. Today, I'm the happiest man or woman on this earth. We are very happy that we have this, that tomorrow we can sit in a classroom that is well-walled, that is floored, that is well-roofed, everything. So we are very grateful to the Honorable MP and the Minister.
From a place of despair to a center of hope, in just 4 months, the educational landscape of Jibri has been transformed. The story here is a powerful reminder that when leaders listen, communities thrive. Reporting for Joy News, Anas Sabit, Jibri.
Oh, let's do some business. The secondary market activity strengthened over the week, with aggregate turnover rising by 43.77% week on week to 2.98 billion Ghana cedis. The following report has more.
Bank research said trading remains skewed towards the belly of the curve, with the 2031 to 2034 maturities accounting for 40.5% of total volumes at a weighted average yield of 12.43%. 2027 to 2030 segment captured a further 36.7% of traded volumes at a weighted average yield of 11.99%. In contrast, activity at the long end was relatively subdued, with the 2035 to 2038 tenors contributing 22.8% of the total turnover at a weighted average yield of 12.81%. According to Data Bank research, it expects the secondary market activity to remain soft in the near term despite rising liquidity. The 376.3 million Ghana cedis cocoa bond coupon payment due in early March 2026 should inject additional cash into the system and help anchor yields.
Well, the cedi continues to recover strongly against the US dollar for the first 2 months of this year. The new data picked up from the commercial bank showed that year-to-date depreciation has slowed significantly under 2%. More in the following report.
In February last month, the cedi's rate of depreciation against the dollar stood slightly above 4%. Now, new data that we have picked up from the commercial banks based on their rates showed that it has dropped significantly to 1.65% against the dollar. The development can be linked to improved liquidity support coming from the Bank of Ghana and a slowdown in dollar demand from businesses. Now, if you look at just the month of February, the cedi actually recorded more than 2% jump in appreciation. This has actually helped slow down the overall performance from January to now to this new level. Now, if the current trend should continue, it's likely that we would end the first quarter of this year with some marginal appreciation against the dollar, a development that has eluded the country in a long while. The Bank of Ghana was hoping to even sell $1 billion through its market intermediation program. However, the market just took about $900 million. Looking at the current spike in crude oil prices, a recovery of the cedi could go a long way to slow the expected hikes in palm prices locally.
Well, that's it for business. That's it for AM News. But don't forget that the AM show is sponsored by Shield Silicone Paints from Azar Group, Syntex Pipes, and Time Herbal Mixture. Now, every day, someone in Ghana is diagnosed with leukemia and asked to travel abroad for treatment. This must stop. Join Build Ghana's first Center for Hematology and Clinical Genetics. Donate to the Leukemia Project Foundation via Stanbic Bank, Silver Star Airport City Branch. The city account is 9040-0043-56815. The dollar account is 9040-0042 99889. Over EcoBank account, Silver Star Airport City. The city account is 1441000144545. And the dollar account is 34410001445544. You can also donate via MTN Momo 054-501-3437, Telecel Cash 020-069-5209. This initiative is by the Joy News Impact Makers Foundation in partnership with the Leukemia Project. And we'll also tell you about World Vision Ghana, because the largest gathering of market actors in Ghana is happening this March in Tamale. World Vision Ghana's Thrive 2030 project presents Ghana National Market Actors Forum. Be part of a powerful national platform that brings together producers, buyers, investors, processors, policymakers, and development partners to strengthen market linkages and unlock inclusive economic growth. The venue is Modern City Hotel Tamale. The date is 24 to 26 March 2025. We invite exhibitors and vendors from the following sectors: 1. Value chains, crops and plant-based value chains, livestock and animal-based value chains, processing and agro-industrial value chains, handicrafts and creative value chains. The second is market actors, buyers and off-takers, aggregators and traders, processors and manufacturers, input suppliers, financial service providers. The third is also market service providers in logistics, packaging, certification, quality assurance, etc. Institutions, corporates, Ghana, NGOs, development partners, policymakers and regulators. So join us in Tamale and be part of a forum that turns market opportunities into real growth for businesses, farmers and communities. For registration and inquiries, contact Priscilla on 054-791-7817 or John 024-3507-669 or Joseph 024-117-8948. Well, that's it for AM News. That's it for business as well. For more news, please do log on to myjoyonline.com. My name is Denise Yapomaije. Have a wonderful show and a lovely day.